So hey guys, what's up? So welcome to World News 20th News Channel. So let's talk about looking at flu with greater respect. With COVID-19 sweeping the globe, we are in the midst of an unprecedented crisis. For me, it brings back memories of the swine flu pandemic of 2009. In April that year, we started hearing about a virus with genetic material from birds, swines, and humans, which was spreading rapidly across the globe. Ours was a new hospital then, and I had just started my career as an eye infectious disease specialist in July 2009. A 40-year-old man who had returned from the Caribbean walked into my room. He was running fever with chills and had bloodshot eyes. He cut a textbook picture of an H1N1 patient. Promptly, I referred him to the infectious disease hospital in Mumbai. He tested positive for swine flu. He was the first case in Mumbai. I had to travel to the Kolkata the next day for a meeting, but I escaped it because I feared I might infect others on the flight. Unfortunately, I didn't fall sick. Over the next few days, we started getting more cases, and they were admitted in the isolation ICU. There was severe stigma associated with the illness, and I remember being reprimanded in the print media when I suggested to well-connected parents that their child could have H1N1 infection. Back then, oseltamivir was in short supply and it needed a special prescription. The test also could only be done in the government centers. We saw many cases and deaths too. However, over the next few months, the virus became a part of our lives. We got used to it. Isolation protocols were relaxed and then eventually stopped. Oseltamivir became freely available. Over the past 10 years. We have regularly got patients with mild and severe H1N1 flu with death, but it is just like any other illness. It didn't change some things though. We looked at flu with greater respect. Rates of the vaccination against the flu increased, and for the first time we started using molecular methods in clinical practice to diagnose respiratory viral infections. In the years that followed, we continued to have pandemic scares. The Middle Eastern Respiratory Syndrome coronavirus MERS-CoV in 2012 to 2013 and the Ebola virus disease in 2014. We prepared for them as well, but fortunately they didn't reach us. Fast forward to 2020, I started to hear about COVID-19 sometime in the mid-late January. It was the end of the January. India started placing travel restrictions, and I remember going to the Mumbai International Airport to speak to the authorities about the disease. I also spoke to the usually apprehensive crew of Air India in the Mumbai who were slated to bring back Indian students standing in Wuhan. February was relatively quiet. 3 students tested positive for the virus in Kerala and recovered well. And cases in China also started declining. We were all optimistic that the virus like the MERS and Ebola wouldn't reach us to the rest of the world. In fact, I booked tickets for summer trip into Europe, but in March, and hell broke loose. And by the second week, South Korea, Italy, and Iran saw an exponential increase in the number of the cases, deaths, with their healthcare system crumbling under the weight of the disease. Then cases starting growing in Spain, the US, France, Germany, and also India. The government imposed international travel restrictions followed by home quarantine, domestic travel restriction, and finally a lockdown. We also prepared to admit patients in our isolation ward, but the COVID-19 is not following in the H1N1 footprint. This virus is more devious and spreads faster. The basic case reproduction rate, number of people infected by 1% for COVID-19, stands at 2 to 3, while that for swine flu is 1.3. The case fatality appears to be higher to 1 to 2% for COVID-19 as against 0.1% for the H1N1 flu. There is no antiviral drug or vaccine for COVID-19 yet, unlike the swine flu where the oseltamivir was available and a specific vaccine was developed promptly. There were no lockdowns and curfews at the time. Now people are fighting many enemies: disease, hunger, and poverty. It is like a state of war. OPD services and elective procedures were affected in 2009 as well, but to a much lesser extent. Now we fear the neglect of the non-COVID-19 patients, and the morbidity of and mortality in this group may exceed that due to the COVID-19 and other public health programs for immunization. TB, HIV, vector-borne diseases are sure to take a hit. This did not happen during H1N1. Healthcare workers are most vulnerable to the COVID-19, and hence the need for the personal protective equipment is much more than recommended for flu. We are already starting at the PPE shortages, and then the morale of the healthcare workers is at an all-time low. And then there is the infodemic. The explosion of the information on social media now is infinitely higher than during H1N1. Everybody is an expert and many remedies are doing the rounds, and people are self-medicating. Hydroxychloroquine and azithromycin are being mentioned everywhere. There is an air of panic, anxiety, and hysteria. But compared to 2009, we also have certain advantages now. The responses of the government and public health system are stronger and sturdier. And healthcare system all over the world are connected like never before. So let us be hopeful. Will this virus just vanish, coexist with us, or overwhelm us? Time alone can tell. So if you like the channel, so kindly subscribe to it.